welcome to LUCOSA TV. Today we have the pleasure of hosting Dr. Michael Ezeanochie, a distinguished consultant and a gynecologist, an educator and a leader in women's health. Hello, Dr. Michael. How are you doing?
Good afternoon, everyone. I'm happy to be here today. Nice to meet you all.
Right. So, Dr. Michael, can you talk to us a bit about the incredible work you've been doing and how that has impacted your life?
I'm a medical doctor, a consultant obstetrician and gynecologist, and my area of subspecialty in that discipline is gynecological cancers, or what we call gynae-oncology. In my work, I offer care, specialized care to women,
Mhm.
reproductive tract cancers, and then women health generally in terms of the reproductive system, pregnancy, fertility, and all that. I am also involved in training, the training of doctors who want to become gynecologists and undergraduate medical students. And then finally, I am also involved in research. So those are the domain of the care I work. I work in Nigeria before at a federal government teaching hospital. And currently, I'm working with the government of Sierra Leone and with a team that established the first postgraduate center for training obstetricians and gynecologists in Sierra Leone. So that's basically what I do. Thank you.
Now, that is a great CV, I must say. Growing up, did you ever envision a career in medicine? What exactly inspired you to take this path?
Yeah, as a person, I think I've been always on the side of empathy, helping people, trying to make things better for others around me. And I just somehow found myself leading in class from primary school through secondary school at Lumen Christi. And then as it goes, people say you have to do a professional course. And I was good in the sciences, I was leading the class and the school. And it was just natural. I gravitated towards medicine, especially because you you're able to connect to people's health challenges and offer them solutions. So yeah, empathy drove me to medicine. Academic abilities helped me to actualize that dream, and empathy is still sustaining me in the practice till now.
And would you say, in terms of your leadership, Lumen Christi had a great impact in you becoming who you are today?
I would say so. From the family level, I come from a family of seven kids. I'm the first, and that notion about you being the first, the leader, and the pace setter has always been there. But coming to Lumen Christi, that was outside the home. I was exposed to being endorsed as a leader. We were the first set, so I was the first class prefect, and then also made the first senior prefect in the school. From then onwards, till graduated. So that not only the burden or that sense of responsibility that you don't just act for yourself, we have to consider the environment and its implications. Registered in me quite early in life, and I'll give that credit to Lumen Christi. And then even after graduating, when we set up the alumni, the trust of becoming the first president of the Alumni Association was also on my shoulders. And so, yes, I would say Lumen Christi is a big part of my leadership story in life.
You've built an impressive career spanning clinical work, leadership, and mentorship. Can you tell us about some of the programs you've initiated, like the ones in Nigeria and Sierra Leone, and the ones you've initiated with WHO?
Yeah, where I worked in Nigeria at the teaching hospital, I was involved in training resident doctors
Hmm.
who wanted to become gynecologists in the West African College and the Nigerian Postgraduate College. I was also involved in supervising their dissertation so that they could become fellows and consultants. Um, Providing lectures, research collaboration, attracting research grants and activities to the institution where I worked. And that led me to Sierra Leone, where I currently work. consulting for the government, helping them in developing national strategic policy guidelines that can help improve their healthcare system, and also taking a lead in implementing some of these documents, working with international partners, multilateral organizations, international NGOs who are supporting the work we do, which is unprecedented in the country. The first teaching hospital program to train obstetricians and gynecologists in
Right.
the country. And so I think, yeah, that's basically what I did while I was in Nigeria and what I'm doing now that I'm working in Sierra Leone.
What exactly drew you to gynecology? Because were you inspired by a particular individual? Was there something in the community you saw and you thought that I need to make an impact in this area?
I've always been, I told you, empathy brought me to medicine.
Right.
And even in medicine, I've always gravitated along towards persons who are vulnerable, who are underrepresented, who have no voice. And women are, especially in Africa, where you have a patriarchal society, women are vulnerable. So I liked obstetrics and gynecology because you are helping people who are vulnerable. And also, I had teachers, role models, who were role models and mentors who helped me actualize my vision to and dream of becoming an obstetrician and a gynecologist. And within that discipline of obstetrics and gynecology, persons with cancer suffer a lot in Africa because they don't have access to treatment, they cannot afford treatment, there's no
Yeah.
health insurance. And so it was natural to follow my natural trajectory to gravitate towards working in that cancer space, building myself and training in outside the country in UK. I also been to the US, acquiring the necessary skills to come back and change the story. And also not just changing the story as a clinician providing care to people, but trying to get into the health system, help to contribute to national policy documents, and changing the story at a macro level and not just at the individual level.
Right. With your recent work in Sierra Leone, which is groundbreaking, how was it building those infrastructure and building local talent with a restrictive, should I say, resources? I mean, the operation seems to be very successful. So how were you able to manage all that?
Yeah, while in Nigeria, we used to think that we were a resource constrained setting. But having
Yeah.
come here to work in Sierra Leone, I realized that Nigeria is doing quite well comparatively. A much bigger country, much bigger resources. I'll give you an example. The population of Sierra Leone is less than 8 million, and the GDP is about 5 billion, which is less than the GDP of an average state in Nigeria. But they're a sovereign national entity, and so they have some access that states cannot get in Nigeria. But yeah, I think I'm driven by challenges to see how we can use innovative solutions to achieve success and team goals. I'll give you an example in Sierra Leone, and despite the infrastructural challenges, there was no culture of postgraduate training to specialize in areas of medicine. But the team of resident doctors we worked with when they went for their West African postgraduate exams in obstetrics and gynecology, 8 of them they all passed, which was 100% success rate. And big centers in Nigeria that have been in existence for over 50 years, when they succeed, they typically get around 50% success rate. Some is 0%, 20%. So I think that our small team here, with the
Mhm.
challenges and the constraints we had, we adapted, innovated, and when our candidates went out for external licensing exams, they did extremely well. So I would say we have delivered despite the obstacles we met.
How do you stay motivated when you work in such an environment?
Sorry, I didn't get that.
I said, so how do you personally stay motivated when you work in an environment with limited resources and overwhelming challenges within that environment itself? Because if I understand correctly, Sierra Leone itself has they have the city, they have the villages, and within those villages, there are other villages. So how do you work with this broad group of people who some of them there is no technology reaching them, there is infrastructure is not that great. How do you make it all work?
Yeah, I would say I'm driven by challenges. I love
Right.
challenges. I think that you need to have passion for what you do.
Hmm.
So I'm driven by challenges and I'm passionate about what I do. So I don't look at it like an obstacle or a burden, but
Right.
it's just something to look forward to the next day to confront. And then I think you need to also have the spirit to be team play,
Right.
work with diverse group of stakeholders so that everybody continues to put their eye
Hmm.
on the trajectory rather than on distractions. And
Right.
then finally, you must come to that level of collaboration with integrity, and you must be very highly ethical so that people can trust you when you say, "Let's go this way, let's take this sacrifice." They believe in you, and working as a team, it's always easy to overcome challenges and obstacles.
You have been mentioned as a key trainer at PCMH. So, what is your philosophy when you're mentoring, young potential doctors? Because it seems the review we were able to get online about you is you've done a great job and you're one of the top mentors. So, what do you impact in them? How do you do this?
So at the hospital where I work, we are an international team of doctors. I have a fellow Nigerian who heads the program here as the head of department. We
Right.
have faculty from Ghana and visiting personnel from the US, from Italy, and all that. But I think that the local population here can relate to us as sister West African countries that if we could get to this level and coming to help them, that they can do it too because they can relate to who we are culturally and psychologically. And then two, I make them realize that you have to agree to be mentored,
Right.
and then you have to be willing to fulfill the obligations of a mentee. And that means that you need to be focused, you need to be hardworking,
Mm-hmm.
you need to have ethics, the right work ethics and character ethics, and then you need to be ambitious and visionary so that as a mentee standing on the shoulders of a mentor you can fly very high rather than trying to do it on your own. So
Right.
that's been my overall approach in those who come across me in the training program. And so far the feedback I get is that it's been working because we had an audit and they had to vote for who is their most favorite international faculty, and most of them voted for me, and I won that award. So it gives me uh, some fulfillment that what we're
Right.
doing is being appreciated. Yeah,
Like I would say, a demigod in the making.
I don't have a demigod, but yeah, I was just saying how big.
Right. So we're going to move on to collaboration and furthermore into the advocacy. So from your work with Mama Pekin Foundation to Who Partnership Collaboration, how are you able to deliver the project while still staying within the constraint and keeping all the partners and shareholders happy?
So yeah, the work we are doing here has a lot of international partners, and like I said, multilateral agencies,
Yeah.
international NGOs, local NGOs. The main thing is that we have all agreed on what the goal is,
Mm-hmm.
and then we are coming with transparency,
Right.
and then we are ready to lead with personal example. So if you say this is the task and this is what is expected of everybody, you are in front demonstrating it creditably well. And then once people understand that you are very transparent, you have integrity, you are leading by example, it's easy to galvanize everybody to align with the vision. And once the team is united, you can overcome any obstacle and you achieve it. So I think that's been the overall strategy that we've been using here that has worked for us in the work we're doing in Sierra Leone. And we are now able to, from a non-existent national cervical cancer program, for example, we
Yes.
have covered more than 75% of the country in terms of screening activities. We just did our review last year. We screened over 35,000 women in the country for cervical cancer, which
Wow.
is one of the biggest reported data in this part of the continent. And then two, we are now able to do prevention of cervical cancer in those centers. They refer persons who have suspicious cancer to where I work in PCMH. which is a national referral teaching hospital. And last year, in partnership with the WHO, we've now started doing complex cancer surgeries for cervical cancer, and all that we've done so far have been successful, and the patients are all doing well. These were women who would have been left to die before now because there was no option for their treatment. Or if they had risk, the government fund their travel abroad for cancer care increase. But now they have solutions to their problems in country, and citizens of the country are being trained to sustain these services even when I go back to my country, Nigeria.
I mean, this is beyond amazing because it's like you've given them a second life for those who treated with the cancer situation. So now they can aspire to do more with their life. That's great. How do you see the future of gynecology evolving in West Africa within the next 5 to 10 years, based on your own, opinion? Given that you've
Yeah,
trained a lot
I
of
look
them,
at it from two perspectives. The
yeah.
training colleges that are responsible for postgraduate training are on the right step.
Hmm.
They are expanding access to training. Sierra Leone has joined the training community for obstetricians and gynecologists. Most centers are being accredited across the sub-region for training. So yes, access to training is increasing, and there's a shift in the training philosophy and curriculum from just being certified to a competency-based curriculum. Now, with a competency-based curriculum, at different levels of your training, it is expected that you will be having appropriate level of competence. So that brings in increased quality in the personnel that is being trained, so which I think is desirable. However, an emerging problem recently, which is a global problem, COVID-19, the protracted Russian-Ukraine war, economies in West Africa are struggling, and currencies are being devalued. And health workers, they don't stay one place. They
Yeah.
migrate to where they are better appreciated. And so I think brain drain in the health workforce is a challenge that many countries in West Africa and Africa are facing. So as you are producing good quality manpower, there now emerges the challenge of retaining them to work for local populations. So that's a short-term to medium-term problem I anticipate, but I hope that the governments will create the conducive environment and innovative solutions to retain these persons that the system is training and bringing forth to offer service.
Now, I'm going to move to your. This is going to be more of your value base because you seem to be an individual who is strong willed, focused, and very determined. So, what are some of your personal values and beliefs that anchor you within this demanding work of yours?
I I am a person that is driven by purpose and mission. So there's clarity in where I want to be.
Right.
And then two, I believe that for you to get there easily, always work with mentors, people who have walked that journey before. They can give you more clarity, and it's desirable. And then at a personal level, you should strive to be a person of integrity,
Mm-hmm.
and that way people believe in you more and are willing to support you. And of course, not just having integrity, but you must be hardworking. So wherever I find myself, I give you 110% above the requirements of work. I go the extra mile. And I believe that with these core attributes, having clarity and vision, working with mentors, coming in with integrity to the table, and being a hard worker in terms of developing yourself, in terms of service to people, in terms of teamwork, and in terms of willing to stand in for others when they are down. I think that anybody who has these core values will go far.
Would you say some of these beliefs you got them from Lumen Christi? Or better off, let me rephrase it. How did Lumen Christi impact your beliefs and values?
Absolutely. I think that Lumen Christi gave us, the motto, the best or nothing. So you
Yes.
always strive for excellence.
Mm-hmm.
And then two, when you come in with the moral background the school is, the level of moral education you get and is prioritized, you just have no choice but to be a person that is ethical in conduct and
Yeah.
value system. So, and in the alumni association, we have also tried to project these values. So we don't come in and celebrate people who are non-criminals or people who are fraudsters. Those are things that you want to bring it out, it's frowned upon. If you do that, you hide it. We celebrate ethos, good values, hard work, success, role models for the younger ones. So I think that that culture that came from the school, I'm happy it dominates the alumni network, and we are keeping on to it. So I say yes, the Lumen Christi culture and background has strengthened my personal values, resonated with me, and I'm happy that it's been sustained even within the alumni network till today. So to that, I'm grateful.
What is one thing that people will be surprised to learn about you that is unrelated to medicine?
Wow. Okay. So beyond the talk about work and ethics and values,
Yeah.
I can also learn to unwind. But not all the time. But I do that amongst my family, my Lumen family, people who've known me from childhood before I became a doctor or whatever I am today. I've been with them. So once in a while, I regress into my childhood personality. I will engage in transit within the limits of the law, and then we just share bands together, and then also some of my friends that I've made coming over the years. So yes, once in a while I regress into my childhood and we engage in bands and then a bit of tantrums. I won't say more than that. If you want to know, you come into that space and you get to know.
Well, it seems you have a healthy relationship with, with the child in you. So, and that's something great. Now, when you think about your legacy, both as a clinician and as a mentor, what do you hope to be remembered for?
Thanks for that question. I'm driven by purpose, like I said earlier,
Yes.
and I want to live a life of impact. For those who come across me, who work with me, I just want when they exit
Hmm.
and they reflect on their time with me, they could say, I learned this from Dr. Ezeanochie, or what should Dr. Ezeanochie do if you were in these circumstances? To that extent, if I can do that, I'm happy that I will influence people who come in contact with me by being stern and firm on the values I think I ought to be celebrated. Then two, in the system, the ecosystem around you, the healthcare system, family system, social system, beyond impacting individuals, how can you make community better? Community service, the hospital system for vulnerable populations, how can we, in our little way, get it right? By being active citizens and being more caring. We could all decide to say on the individual level, I've conquered socioeconomic challenges and I'll just isolate myself. But no, I don't work that way. I want to be somebody who is in the community, who contributes to community service, and who made the community better. And people say, we worked on that road because that doctor there motivated all of us to do that. And then finally, I'm very particular about the kind of digital footprints we leave.
Right.
So you want to ensure that when a digital audit is done for anybody, the footprints that will come out are things that will be consistent with a legacy of service, a legacy of contributing to humanity to make it better, and a legacy that people who are affiliated with you will read it or hear it being read in public, and they'll be proud that yes, that was my dad, that was my uncle, that was my dad's friend, that was my friend, I knew that person. So your footprints in the global stage needs to be also in tune with your personal values. Those are the things that keep me motivated.
Thank you for that. And finally, what is next for you? Are there any project initiatives or personal goals you're currently excited about or you're currently working on?
So for me, there's never an end point. It's to keep pushing the boundaries
Right.
until we change the world. And the world to change the world is going to be a Herculean task. But I would say that there are two projects that I'm working on currently that keeps me excited and motivated. One is a health system strengthening initiative that is funded by Google Health Incorporated, um, and is trying to use Google Maps to make it easier for pregnant women in low middle income countries to get to hospital quickly without delay. So
Right.
it's providing real-time information on travel time to policymakers and to healthcare consumers so that they will avoid delays and get to hospital. And the evidence for this is that science has shown that if you can cut off that delay, you can reduce maternal deaths from pregnancy complications by up to 50%. And low middle income countries contribute to more than 80% of the global maternal mortality rate. So if that works out, it's already showing early signs of promise. And if it gets to the scale we want, I'll be very fulfilled to be part of the investigators who worked on that. And then two, in the cancer space, my subspecialty, I've become part of a consortium that involves Americans, Caribbeans, and Africans. And we have realized that cancer care is getting to the level of what they call precision medicine. Now, you can personalize the treatment a person with cancer gets based on his genetic profile and biomarkers. However, on the global scale, the genetic footprints of Africans are not there in the biobank.
Mm.
And so we are being given treatment options that is not reflective of who we are. We are unique.
Yes,
So
indeed.
the aim of this consortium is to create a global pool of genetic imprints from persons of African ancestry, including African Americans and the Caribbeans, to begin to run analysis and to get direct evidence on how to offer personalized care based on genetic evidence and biomarker evidence like RNA synthesis for persons of African ancestry to benefit from the era of personalized cancer care. With personalized cancer care, treatment is becoming less toxic. You can predict which drug a patient will respond to based on the biomarker or your RNA or DNA sequence. You can use the right dose. You can avoid drug resistance. You can avoid side effects. So we hope that the data that will come out from this consultant will change the space for persons who are of African ancestry in terms of cancer care, and that to me will be a very, very fulfilling research project at its conclusion.
Finally, what advice do you have for the youngsters out there? Be it an aspiring doctor, a Lumen Christi student, a graduate, just a young individual that is trying to find their way in this world.
Yeah, they say the man in you dies when you stop aspiring to be greater. You never stop till you die. One thing I would tell anybody who's aspiring to be better than where he is to identify your purpose and have clarity in your vision for what you want for yourself. You need to reflect very well to find out. Not everybody has understood that. Once you have gotten that, is to identify mentors. At every stage you get to, as a high school student or university undergraduate or early career person or even a senior career person, get a mentor who's walked through that pathway and who will guide you so that you can avoid mistakes from their experience and you can accelerate faster. The mentee mentor relationship also has responsibilities on the mentee, the person who is looking for a mentor. You need to fulfill that obligation. You need to be hardworking. You need to fulfill tasks and expectations that your mentor has put forward in you. And so, therefore, you don't say you're my mentor and you just sit back and relax. No, you need to be hardworking. So, hardworking is an important tool for anybody who wants to get higher. I used to tell some of my mentees a joke: how many hours do you sleep a night? If you tell me you sleep 8 hours, you go to bed by 10, you wake up by 6 a.m. I say, well, what that means is that in 60 years, you've been sleeping for 20 years, and somebody else who's been sleeping for probably 6 hours has cut extra 5 years of potential hard work time. I'm not saying we shouldn't sleep. Sleep is good, don't get me wrong, but I'm just saying the value of time spent on hard work, working smartly, working efficiently in all aspects of your life can improve your productivity. So getting a mentor, having purpose, being hardworking are very important. And then finally, always be sure that the messaging you give about yourself portrays integrity and ethics. Even if you say you are just with somebody in a room and you behave unethically, it doesn't become a secret anymore. Tomorrow, if you find yourself on the other side of the divide with that person, the testimony he will be giving about you is that I've been in the same room together and on the same team. That guy behaved unethically. I'm sure that where he is now, he's also behaving what? Unethically.
Unethically.
So always be sure that consistently in all situations, put yourself on the balance of ethics and integrity. Where will this action stand? If you stand on the side of ethics and integrity, then your word becomes strong currency that can open big doors for you. People will take their reputation for you because you're hardworking, you have the right mentors, you have clarity of purpose, and if you say this, that's it. You're ready to go. So that would be my advice for aspiring people who want to move to the next level in their life. It's worked for me, and so I think, yeah, you could consider some of them.
Thank you very much for sharing your wisdom with us. And we hope you keep aspiring more and you keep achieving more. And we hope you have a great day. Thank you, Dr. Michael Ezeanochie. Have a good day.
Thank you very much. It's really my pleasure joining you on this session.
Thank you.